The Invisalign Progress Assessment tool compares Invisalign patient progress with the ClinCheck treatment plan generated by the doctor using the ClinCheck software. Invisalign Progress Assessment tool can be used to monitor progress during all stages of treatment and also for post-treatment evaluation. This tool enables doctors to track the treatment against the ClinCheck treatment plan and make adjustments as required. It also serves as a visual aid to encourage patients and involve them in their own progress. Invisalign Progress Assessment tool enables patients to visualize their treatment journey and to understand the importance of wearing the aligners to achieve the best clinical results. During the first follow-up visit and after scanning the patient, go to the patient's pane on the scanner or in the myitero.com portal. Select the patient name and scan date, and tap the Invisalign Progress Assessment button. If necessary, adjust the axes and teeth numbers, and tap the Progress Assessment button. Select the desired patient from the list, and tap Next. Select the treatment plan for comparison with the scan, and tap Next. Drag the sliders to select the patient's current aligner number and tap Done. The Progress Assessment Report displays a 3D model of the simulated progress of the treatment plan stage against the 3D model of the current status. The Current Stage button indicates which treatment stage is defined for the current dentition. The stage can be changed by tapping this button. The stage slider indicates which treatment stage is displayed on the treatment plan model. To change the stage, tap and drag the slider, or tap either the initial, current, or final buttons. The teeth in the current dentition model are color-coded to indicate their status compared to the plan. The legend defines each color in the 3D model. For example, green is for movement tracking according to the treatment plan. Purple is for movement in the opposite direction to the treatment plan. White indicates the tooth is not assessed. Teeth colored in yellow, purple, or gray aren't tracking as expected. The report panel displays tooth movement measures for each of these 6 dimensions. The colors shown on the 3D models are the same as those used in the panel. The 3D model will display the worst color for the movements programmed on that tooth. Click the required button to see information for this category. The upper and lower arch buttons display measurements for translation buccal-lingual, translation mesial-distal, extrusion-intrusion, angulation mesial-distal, inclination buccal-lingual, and rotation mesial-distal. The sagittal button displays measurements in millimeters for molar and canine class right and left, overjet, and degree of the interincisal angle. The vertical button displays the anterior overbite measurement in millimeters. The transverse button displays the intercanine and intermolar width in millimeters for the upper and lower arches. The arch length button displays a millimeter measurement for crowding or spacing, if present, for the upper and lower arches. The assessment toolbar includes tools that control the display of the Invisalign Progress Assessment information according to your needs. For example, clicking on Arches and Super displays the arches separately, with a superimposed treatment plan. The Super feature superimposes the plan treatment in translucent blue on the current scan. This is a powerful visual aid that demonstrates favorable progress or disparities in one image. The single, arches, and dual tools control the 3D model display. The single tool displays the scan only. The arches tool separates the model into an overview of both arches. The dual tool is the default display and compares the treatment plan model with the current scan. These tools must be used separately. The views cannot be displayed simultaneously. The report button switches the report panel display on and off. Enlarging the display of the model clears the screen of unnecessary information when presenting to a patient. The Assess button toggles the color-coded display that indicates the treatment assessment. The Legend button toggles the Legend panel display. The Primary View's toolbar includes shortcuts for the display of the 3D models. Use the Trans or Rotate button to drag the model in the display pane or to rotate it in any direction. Use these buttons to display only the upper jaw, lower jaw, maxillary occlusal, right buccal, anterior, left buccal, and mandibular occlusal as required. The Invisalign Progress Assessment tool is a powerful tool for visualizing tooth movement progress during the Invisalign treatment plan. The 3D model of the patient's current dentition can be compared with any stage of the planned treatment. Teeth color-coded to indicate if they are moving according to plan. In the current dentition model, teeth colored in yellow, purple, or gray aren't tracking as expected. The report panel displays movement measurements in various dimensions to assist the doctor when making clinical decisions. The current dentition model can be superimposed with the expected positions and viewed in multiple modes and angles. It starts with iTero.